Right now, if your legs feel weaker even though you try to eat well and look after yourself, I want you to listen closely. You may think this is just aging, but there is a hidden reason why muscles are shrinking faster than they should. It is not lack of willpower, it is not protein, and it is not because you are lazy. One missing vitamin is sabotaging your strength, your balance, and your independence, even if your last blood test looked normal. In the next few minutes, I will show you how this hidden deficiency steals muscle, how to know if it is happening to you, and the daily steps you can take to rebuild strength starting today in a way that feels safe, realistic, and doable for you. Let us begin with what is really happening to muscle after 60, beneath the surface of ordinary daily life. Doctors use the word sarcopenia, but you have probably felt it in much simpler ways. The stairs that used to feel routine now make your thighs burn halfway up. Getting out of a deep chair takes more effort and a little rocking motion. Your legs feel unsteady when you stand up quickly or carry groceries across the room. Research suggests that after 60, many people lose around 3% of their muscle mass every single year if they do nothing to push back. Over a decade, that can mean almost 1/3 of your muscle gone. That is the difference between walking across your living room with confidence and feeling like every step needs to be carefully planned. For a long time, the story mostly stopped there. Doctors and even family members shrugged and said, "This is just what happens with age," as if muscle loss were a kind of slow weather pattern you simply have to accept. You may have heard phrases like, "You are just getting older," or "Of course it feels harder now. Look at your age." Those words sound final, like a door gently closing. But that story is incomplete. Age matters. Sitting too much matters. Yet they are not the whole picture. Inside your muscles, there is another force at work, one you can actually change. It is a vitamin that most people think of as a bone helper and nothing more, the vitamin doctors mention when they talk about calcium and fractures. In reality, it is a powerful messenger that tells your muscle cells when to build up, when to repair, and when to hold on to the strength you already have. To understand how important this messenger is, picture a construction site. On one side of the site, there are piles of bricks, steel beams, and bags of cement. That is your protein, your calories, and the basic nutrients in your meals. On the other side, there is a group of workers standing around, waiting. That is your muscle tissue, ready to respond. What is missing is the foreman with the blueprint, the person who gives the orders and coordinates the work. Vitamin D is that foreman. Every healthy muscle cell has special receptors for vitamin D, like tiny locks designed for one specific key. When vitamin D arrives and fits into those locks, it turns on genes that control muscle protein synthesis, the process your body uses to build and repair muscle fibers. Without that signal, the workers have no clear instructions. You can eat plenty of good food, you can even exercise, and still your muscles slowly shrink because the main message telling them to grow is not getting through. Low vitamin D also lights a slow, invisible fire inside the body. It increases background inflammation, a kind of constant low-level irritation in your tissues. Inflammation is useful in small bursts, like when you are fighting an infection or healing a cut, but as a steady state, it becomes destructive. It speeds up the breakdown of muscle tissue at the same time as it interferes with building new muscle. So when vitamin D is low, you face a double hit. Your body cannot build muscle efficiently, and it is breaking down the muscle you already have more quickly. On the outside, you may notice this as a general heaviness, as if your body is harder to move than it used to be. Climbing a single flight of stairs leaves you breathing harder. Carrying groceries feels more like carrying rocks. You may say to yourself, "This must be age," But inside your cells, a different story is playing out, one that can be changed. The natural question is why this deficiency is so common in older adults who feel they are doing many things right. In your younger years, your body often kept up without much effort on your part. You went outside more, your skin was better at making vitamin D from sunlight, and your digestion absorbed nutrients with fewer problems. After 60, several quiet shifts come together. First, the skin becomes far less efficient at producing vitamin D. Some research suggests that an older adult may make only a quarter of the vitamin D from the same amount of sun that a younger adult would. That means a pleasant walk outdoors that once met much of your daily need now barely covers a fraction. Second, lifestyle changes reduce sun exposure. You may be retired from outdoor work, prefer shade because heat or cold feel harsher, or simply spend more time indoors reading, watching television, or caring for grandchildren. Sun that lands on your skin through a window does not count because glass blocks the ultraviolet light your body requires to create vitamin D. Third, the sun itself is not always positioned to help you. If you live in a place where winters are long and the sun stays low in the sky, there can be months when your skin cannot produce any vitamin D at all, even if you are outside at midday. Factor in sunscreen, which is valuable for skin cancer prevention but also blocks vitamin D production, and your natural supply line becomes very thin. Food was supposed to be the backup plan, but only a few foods contain significant amounts of vitamin D. Fatty fish like salmon and sardines, egg yolks, and some fortified dairy or plant milks provide some, yet most people do not eat these in large enough amounts often enough. Add all of this together and a clear picture emerges. You are getting less from sunlight, less from food, and whatever small amount hides in a basic multivitamin is often too low to fix the problem. This is why so many older adults feel they are doing what they were told and still notice their legs fading. They eat vegetables, they avoid junk, they take a standard multivitamin, and they go for gentle walks. Yet each year they feel a little weaker and a little more cautious on their feet. It feels as if their efforts do not count. In reality, their muscles are trying to work in a signal-poor environment. The protein is there, the willpower is there, the movement is there. The missing ingredient is the vitamin D message that tells the body, yes, build this muscle, keep this strength, hold on to this independence. Because vitamin D is invisible, the only way to know where you stand is to test it. Without a blood test, you are flying blind. The specific test you need is called a 25-hydroxy-vitamin D level. The result comes back as a number measured in nanograms per milliliter. On the lab report, there is usually a wide normal range printed, and anything above 30 is often stamped as acceptable. The problem is that this normal range was not designed specifically with muscle strength and fall prevention in mind. It is more of a general safety zone. When scientists study older adults and focus on how quickly they can stand from a chair, how steadily they can walk, and how likely they are to fall, they often find that the sweet spot is higher, somewhere between 40 and 60. That means a person with a level of 32 may be told everything is fine, while their muscles are still struggling at the lower end of what they truly need. So the first practical step is simple but powerful. When you next see your doctor, ask specifically for a vitamin D test and then ask for your exact number. Do not settle for the word normal. Write that number down. Treat it as you would your blood pressure or your cholesterol. It is a measure of how well supported your muscles are. If it is below 40, that is a clear sign that your body may need help. Even if it is in the low 40s and you are dealing with weakness, unsteadiness, or frequent aches, talking about raising it toward the middle of that optimal window can make sense. You are not chasing a perfect number. You are giving your body a better environment to hold on to strength. Once you know your starting point, you can begin to rebuild that environment by supplementing vitamin D in a way that really works. Because vitamin D is fat-soluble, it must ride along with dietary fat to be absorbed efficiently. Swallowing a vitamin D pill with only water or a dry cracker means that a large part of the dose may pass through unused. On the other hand, taking the same dose together with a meal that includes healthy fats, such as avocado, nuts, seeds, olive oil, eggs, or fish, dramatically improves absorption. A simple shift to taking vitamin D with your largest meal of the day can turn a weak effort into a strong one. The form you choose matters just as much as the timing. Supplements usually come in two versions. Vitamin D2 is derived from plant sources, while vitamin D3 matches the form your own skin produces when exposed to the sun. Study after study finds that D3 is more effective at raising and maintaining vitamin D levels in the blood. When you look at a bottle, you want to see vitamin D3 or the word cholecalciferol clearly listed. For many older adults with low or borderline levels, a daily dose between 2,000 and 4,000 international units of vitamin D3, chosen in partnership with a health professional, is enough to slowly lift them into the optimal range. Some people with very low starting levels may need a higher dose for a short period under medical supervision, and then move back to a more moderate daily amount. Another crucial factor is rhythm. Vitamin D does not behave like a pain tablet. You do not feel an instant change after one pill. It accumulates in the body, filling up stores in the liver, in fat tissue, and within muscles themselves. It usually takes around 3 months of consistent, appropriate dosing for the body to fully refill its vitamin D reserves and for the muscles to feel the difference. During that time, changes are happening quietly beneath the surface. Inflammation is easing down. Muscle cells are gaining more of the signal they need to grow and repair. If you stop too soon because you do not feel a dramatic shift in the first few weeks, you cut the process short. That is why consistency matters more than excitement. A steady, moderate dose every day is far more powerful than a burst of enthusiasm that fades in a week. There are a few easy ways to protect the effort you are making. If you take fiber supplements like psyllium or specific fiber powders, try to separate them from your vitamin D by several hours because fiber can bind to fat-soluble vitamins and reduce how much you absorb. Keep your vitamin D where you will see it at the right time, near your dinner plate or next to your evening tea, so it becomes part of your routine. Some seniors like using a simple pill organizer so they can see at a glance whether they have taken that day's dose. The goal is not perfection, but enough regularity that your body can count on this support. Correcting vitamin D, however, is not the final step. It is the foundation. Once that foundation is in place, the other pieces of muscle health can click into position. Your body needs building materials in the form of protein. It needs supportive co-nutrients like magnesium and vitamin K2. And it needs a reason to build muscle, which comes from resistance exercise. Think back to the construction site. The vitamin D foreman is back on duty, but the building still requires bricks and beams and a clear plan for what to construct. Protein is the raw material for muscle tissue, yet many older adults do not eat enough, especially early in the day. Appetites change, chewing can become harder, and habits from years of small breakfasts carry over. A helpful target is to aim for at least 0.5 grams of protein per pound of body weight each day. For a person who weighs 150 pounds, that is about 75 grams of protein spread through breakfast, lunch, and dinner. That might look like eggs or Greek yogurt in the morning, beans, lentils, or cottage cheese at midday, and fish or poultry at night. If solid food feels heavy, a simple protein smoothie can fill some of the gap. The important point is that once your vitamin D level is in a healthy range, every gram of protein you eat can do more for your muscles than it could before. Magnesium and vitamin K2 act like quiet assistants in the background. Magnesium helps convert vitamin D into its active form, the version that can actually deliver its message to cells. It also supports normal muscle relaxation and nerve function, which can influence how your body feels after activity. Leafy green vegetables, nuts, seeds, and whole grains contain magnesium, and in some cases a supplement may be helpful, always after checking for interactions with medications. Vitamin K2 works together with vitamin D and calcium, directing calcium into bones and muscles rather than letting it settle in the walls of blood vessels. Certain cheeses, fermented foods, and some supplements provide K2. When D3, magnesium, and K2 are present together in the right amounts, the environment in your body becomes far more friendly to strong bones and resilient muscles. The final signal your body needs is movement that asks your muscles to do slightly more than they are used to, in a safe and controlled way. Walking is excellent for the heart, the lungs, and the mind, but on its own it does not always send a strong enough message to the muscles that they must grow. For that, your body responds best to resistance exercises, movements where you lift your own body weight, push against a surface, or work with a band. You do not need a gym membership or heavy equipment. Twice a week, you can perform a simple circuit at home. You might begin with 10 chair squats, standing up and sitting down from a sturdy chair with your arms crossed, or resting lightly on your thighs. Then you can do 10 wall push-ups, standing at arm's length from a wall and lowering your chest toward it before pushing back. Follow that with 10 slow heel raises while holding the chair back for balance, lifting your heels off the ground and lowering them down with control. Finish with 10 gentle rows, using a resistance band looped around a railing or a heavy table leg, pulling the band toward your ribs and squeezing your shoulder blades together. At first, this small routine may feel surprisingly demanding, especially if you have not done strength work before. That is normal. The key is to move at your own pace, rest when you need to, and celebrate completion rather than perfection. As weeks pass and your vitamin D level rises into the healthier range, you may notice that the same routine feels a little easier. Your legs push more firmly against the ground, your arms feel steadier, and your breathing recovers more quickly. That is your body answering back. When you are ready, you can add a second round of each exercise or a few extra repetitions, gradually nudging your muscles to keep adapting. You are not training for a race. You are training for everyday life, for the ability to walk across a parking lot, climb a flight of stairs, and stand up from a sofa without fear. There is one more piece of the vitamin D story that is worth mentioning, and that is sunlight itself. For years, many people were told to stay out of the sun as much as possible, and while it is true that sunburn and long unprotected exposure raise the risk of skin cancer, avoiding all sun can quietly worsen vitamin D deficiency. The goal is not to sunbathe for hours. The goal is brief, sensible exposure on bare skin. Even short periods of midday sun on the arms and lower legs can help support vitamin D production, especially in the warmer months. If you have a history of skin cancer or your doctor has advised you to avoid sun completely, then supplements become even more important for you. The key is balance, not fear. Light in the right dose can be part of your healing plan. Another powerful but less obvious benefit of healthy vitamin D levels is how they protect you during and after illness or injury. When an older adult has surgery, catches a severe flu, or spends a week largely in bed, muscle loss accelerates. A few days of immobility can erase weeks of progress. Seniors who maintain adequate vitamin D levels before these events often recover muscle function faster afterward. Their bodies are better prepared to rebuild what was lost. In a very real sense, tending to your vitamin D now is like buying insurance for your muscles. You hope you will not need that extra margin during a hospital stay or a difficult season, but if you do, your body will be ready to respond. It is also important to see how all of this connects to the rest of your health, not just your legs. When muscles become weak, people naturally move less. When you move less, your heart and lungs get less training, your blood sugar control worsens, and your mood often drops. You may sleep poorly, feel more anxious about falling, and slowly shrink your world to fewer rooms and shorter outings. This is the downward spiral many seniors quietly slide into without understanding why it feels harder every year. By restoring vitamin D, feeding your muscles with protein, and adding just a little purposeful strength work, you start turning that spiral in the other direction. More strength makes movement easier. Easier movement boosts heart health and mood. Better mood and energy make it more likely you will keep showing up for yourself. You might still feel a bit unsure. Maybe you have tried supplements before and felt overwhelmed by the conflicting advice. Maybe numbers on a lab report make you nervous, or you worry about taking too much. It is completely normal to feel that way. The good news is you do not have to solve everything at once. Think of this as a 3-month experiment guided by information instead of guesswork. You are not promising perfection. You are simply agreeing to give your muscles what they clearly need and to watch what happens. If after that time you feel stronger, steadier, and more confident, you will know that this is a path worth continuing. If you need adjustments, you can make them from a place of knowledge, not confusion. Now imagine where you could be 3 months from now if you decide to put these pieces together. You have asked for and received your vitamin D number, so you are no longer in the dark. You have chosen a vitamin D3 supplement and placed it where you will see it with your main meal. You have gently increased the protein on your plate and made sure that at least twice a week your muscles feel the pleasant challenge of lifting, pushing, and rising. You are not chasing perfection. Some days you do a full routine. Other days you simply take your vitamin D and add a few extra chair stands. Both days count. Little by little, the stairs at home seem less like an obstacle. Standing from a low chair feels less like a struggle. You notice that you are walking with just a bit more confidence, turning your head to greet someone without worrying that your feet will not keep up. These are the quiet victories that come from understanding what your muscles really need and finally giving it to them. If this message has opened your eyes, let today be the day you stop guessing and start acting. Do not wait until another year of quiet muscle loss makes the stairs steeper and your world smaller. Talk with your doctor about testing your vitamin D level and ask for the exact number, not just the word normal. Then commit to a daily routine that includes vitamin D3 with a meal, solid protein at every sitting, and 2 simple strength sessions each week. For the next 3 months, treat this like a promise to your future self, not just another pill on the counter. In the comments, share which step you will start with today so others can learn from your example. And if you want more clear, science-based guidance made for seniors, subscribe and stay with us. Your muscles are still listening. Now give them the signal to grow.